Good morning, everyone. My name is Livier, and I'm a medical doctor and public health specialist at the World Bank. And as a Youth Advisory Group member, I am very glad to welcome you to this session on the care economy and its role as the bedrock of participation in democratic societies. When we speak about participation, we often focus on access, representation, or voice. Yet, participation is not only a matter of opportunity, it is a matter of conditions, and care is what creates those conditions. Where care is present, participation flourishes. Where it is absent, we see patterns of exclusion, stress, and inequity that are deeply structural. So today, we will explore care not as a sector, but as an infrastructure, a foundation for well-being, a foundation for dignity and for democracy. It is my great honor to welcome today Christine Robinson, Fulbright Specialist, Senior Fellow at Carsey School of Public Policy, New Hampshire. As an architect of care economies, her work has articulated the 8-strand braid of care vision, offering a powerful systems framework for designing the condition of full participation. Christine, the floor is yours.
Thank you so very much. Good morning. In respect of the time limits of the setting, I'm going to read from prepared remarks today. Warm thanks to Dóra and to the forum and the organizers of this convening and this important gathering. It's an honor to be here, and I'd like to begin with one simple and urgent proposition. Modern societies measure what is easy to count: GDP, productivity, efficiency, and growth. But the question before us is deeper. What truly makes human participation and collective well-being possible? Can people fully and authentically participate in democratic societies? A nation may grow richer even as its people grow weary. People may accumulate wealth, yet lose health and hope. Institutions may expand, yet trust may erode and exclusions may persist. What are the real circumstances, the essential precursors for human beings to authentically participate, to flourish, and thrive in a democracy? What creates the conditions of collective well-being and belonging? My proposition is simple: care is the bedrock. I come from the US, but I come to this work through many doors. Doors of experience, of the heart, of research and scholarship. I am a caregiver. I am a mother, a sister. My life has been shaped by disability and interdependence. My only sibling was born with significant developmental and neurological challenges, and I am now the guardian. I cared for my aging parents as they neared the end of their journeys. I recently began a 3-year appointment as a Fulbright specialist, dedicating a significant portion of that time to collaboration with Nordic nations. Few regions have so deliberately built societies anchored in equity, public trust, and collective well-being, prioritizing human flourishing over economic output alone. My career has focused on understanding what enables people and communities to participate fully, belong, and thrive. For years, I have admired countries that embed these values through thoughtful public systems, human-centered policy, and sustained investment in the common good. In the coming years, I am not here simply to visit, but to forge lasting relationships, learn deeply, and contribute meaningfully as Nordic nations advance these essential conversations. Professionally, my roots run deep in psychology, public health, and child development. I stood in classrooms as an early childhood educator, offered support as a home health aide, walked alongside survivors of domestic violence, children seeking safety, migrants entering new nations. I had the privilege of serving as the director of the Division of School-Age and Adolescent Health for the Commonwealth of Massachusetts and headed up statewide child and youth health programs, violence prevention, poison control, passenger safety, serving millions of children and youth. I co-authored the National Childhood Obesity Initiative of the Robert Wood Johnson Foundation and worked on environmental grassroots strategies and engagement. And through it all, one question echoed: why do some people in communities thrive while others struggle? Over time, one truth emerged, clear and undeniable. These outcomes are never random. The roots are structural, the roots are systemic, and they are ours to change. As we have heard this morning, harm is not random. Across more than 35 years of work, I've witnessed one truth again and again. When the right conditions exist, people blossom, creativity flourishes, health rises. Those conditions are stripped away and people wither. Harm is not an accident of fate. Harm follows a pattern. This is not about individual will or character. This is about the world we build together, the circumstances that either lift people up or weigh them down. When harmful conditions persist, they do not just hurt temporarily, they invade the body, the mind, the economy, and the soul. They shape long-term distress, and they diminish well-being. If that pattern can be built, it can be broken. We have the power to break it. Care is the ongoing relational and organized activity of noticing, interpreting, responding to human and ecological needs, and of maintaining, repairing, and transforming the web of life so that everyone can live and flourish with dignity across generations. Research has long shown us that exclusion, chronic vigilance, create measurable burden. When people are constantly navigating exclusion, othering, surveillance, or marginalization, they carry that burden physically and psychologically. This is allostatic load, the cumulative physiological wear and tear. This is the outcome of decades of oppression. The result is earlier disease onset, faster deterioration, shortened lifespans. Importantly, this is not limited to race. This applies broadly to all traditionally marginalized populations across the globe. However that population is marginalized in whatever society, be they women, people with disabilities, immigrants, people who are LGBTQ, people living on the margins of any society. Again, this is not an individual deficiency. The issue is systemic inclusion, pervasive negative stereotypes. There is a devastating cost to neglect. The cost is counted in lives cut short, in preventable illnesses, in the unsupported costs of disability, in families who collapse under relentless pressure, and in communities robbed of clean air, clean water, and hope. Some ask, can we afford care? How much will this cost? But I ask you, can we afford neglect? What is the price of inaction? What is the price of indifference? The care economy is the foundation of society, vital, life-giving, and too often invisible. Globally, care labor remains disproportionately carried by women and remains undervalued despite being foundational to every economy. Care shapes our development, our relationships, our futures. It is present at our first breath, at our last. Let us be clear, care is not just a labor sector. It is not only child care, elder care, or disability services. Care is the bedrock of participation in a democratic society. Without caregiving labor, economies and institutions cannot function. In the US alone, over 83 million people, 1 in 4, live with a disability. Without adequate caregiving systems, millions are left unsupported and excluded from participation. Care underpins all progress. Care shows up everywhere in who can enter a building, and whose needs shape our cities, and how we steward the earth. Care is the architect of possibility, not a single thread, but an interwoven braid making participation possible. And I call this the 8-strand braid of care. Over decades of systems work, I have defined 8 interdependent strands that shape whether participation is possible, and together they form the bedrock of well-being. There is a handout that explains the framework at each table: recognition and humanity, relational care and belonging, cultural infrastructure, structural and policy design, economic stability, civic voice and power, healing and meaning, ecological justice. These strands are interdependent. Together they determine whether full, authentic participation is possible. Across all my analysis, one core truth emerges. These strands are not separate. They are an interdependent infrastructure. When one weakens, the whole system weakens. When multiple strands break down, systems destabilize. Recognition without economic stability is insufficient. Economic stability without ecological care is insufficient. Belonging without civic voice is insufficient. Voice without structural redesign is insufficient. This is a systemic dynamic. The framework is not abstract, it is visible in daily functioning in real institutions of workplaces, schools, and communities. Psychological safety is care, trust building is care, setting clear expectations and holding each other accountable is care. Strong networks are care, inclusive design is care. When we infuse our institutions with care, everything changes. People thrive, systems are bolstered, because care is not a weakness. Care is strategic capacity. Care is power. Care is bedrock. When care becomes infrastructure, trust is restored. Participation increases. Innovation grows. Health improves. Communities stabilize. Institutions strengthen. Human capacity expands. Care is not a side concern. It is a strategic architecture. I am now entering into the next phase of this work, and I am identifying a small number of early implementation partners to help pilot, test, and refine the braid in live institutional settings. These early collaborations will directly inform the development of an international field guide for applied care center institutional design and establish meaningful measures for application and evaluation. I am seeking thoughtful partners prepared to engage seriously in this work, not simply as participants, but as co-creators who will help shape this emerging framework for broader future application. If this aligns with your work, I would welcome future conversation. Where are your systems in participation and flourishing? What does it look like? And what becomes possible when care is made foundational, infused intentionally through every aspect of institutional life? Thank you. Care is the bedrock of participation. Then reimagining care may be among the most important responsibilities before us. I would welcome the opportunity to return for focused working sessions, advisory engagements, or design conversations to help apply this framework in your context.
Thank you, Christine. Thank you so much. You have really pointed out that we can't have a Wellbeing Economy Forum without having the topic of care economy, which is a very important contribution to the wellbeing economy. And we've decided now to extend the panel discussion to the tables. And Livio will explain a bit how we're going to do that. So please.
Thank you, Dóra. Dear audience, we will now move from a conceptual framework to the care economy to actual contribution from your side. So now is the time to discuss between you on your own table and propose answers through Slido. So you will see a series of 3 questions appearing on the screen, and you will have the possibility to answer with short answers. So you will have about 2 minutes per question to discuss and give us your inputs for time purposes.
It's the beginning of a discussion that we can continue. But yeah, we would like you to start discussing on your tables and find out then how you want to answer. So, as Christine has mentioned, there are some, if you want to know more, there are some handouts on each table. But yeah, the first question, do you want to read it out?
Yeah, of course. So the first question, where in your current systems do you see the strongest conditions for participation and well-being? So now is the moment to tell us about where you think care is in your current systems and structures.
think discuss it as well. Yeah, we can have.
Maybe we can think about it in terms of the forum itself, because I think it's a good example. It's based on a territorial situation that is very favorable. We're discussing about it in terms of access, how much Iceland is accessible and sustainable in terms of its action. So it's a good environment for this conversation to happen.
Do you see this from the screen? No. So workplaces, family, kindergartens, universal institutions, yes, community, municipality, church, yoga studio, empowering caregivers.
Yeah, no, I love this. I love this. 1,000 flowers blooming.
Yeah.
Everyday
Life settings, health promotion centers, and primary healthcare level, decision-making retreats.
I think also this is a very good example of participation, and of autonomy, and how we created the session together. So that's very interesting. Okay, so school, community, family, workplace. We've seen some sports situation example as well. So time was okay. 30 seconds to share with us your inputs. Only 26 for the moment, so yes, please send them in.
Caregivers. I'm looking at the ones that are repeated are across the top.
Yeah.
And that's useful to know.
Yeah, they do also categorize it, or they sum it up. Who has the most? Family has 4, caregivers 4, workplace 4, community, of course.
Community and schools seem like they are.
On top.
Yeah.
Yeah, that's the one. Community school.
Okay, thank you. Thank you so much for your contributions. On the basis of what we have at the moment, Christine, what do they tell us, in your opinion, those outputs that we are seeing on the screen, what do they tell us about where care is already functioning as infrastructure in our societies today?
I think this is really interesting because community and schools are the top, shall we say, and we can look throughout as people continue to put their answers in. I love the notion that community care is something that's still real. I'll speak for myself, but I grew up in a community where we were in and out of each other's backyards all the time. Everybody knew each other. There was this sense of neighborliness and well-being, and I'm glad to hear that that is something that people are still finding. That's just kind of a natural. I think that that has a lot to do with the believing in the inherent dignity of all people, that we have more in common than divides us, and looking at those commonalities. And I think that that's essential if we're going to look at a well-being economy. Part of it is the individual, kind of what as individuals we can do, but how that radiates out to others within our own
Absolutely.
society.
Thank you so much, Christine. And Dóra, in your opinion, what are the strongest strengths that help anchor us in the idea of recognition and the idea of relational care?
The strongest recognition, I think, yes, and also relate to what has been just talking about the well-being. It's so important that you feel that you're seen and that you really matter in the society. And where are you seen and where do you matter? And I think in schools it's very important, and we can see we are seeing some numbers of kids who don't